My name is Jan Flugel, and I'm a member of the support group. I'm a myeloma patient. And when I got myeloma, it was difficult enough dealing with the physical and emotional issues related to the myeloma, let alone the financial issues. I was the financial head of the household, and I had a full-time job. And there were several financial issues that I had to deal with, and I didn't find a source of financial information that was useful in Ontario to deal with the spectrum. So we've decided to put this presentation together today to try to give people an overview of the spectrum, but that's quite ambitious. What we've tried to do is also create a document here that provides links for people to go deeper on specific areas that are of interest to them. And this presentation is being recorded. It's going to be on the Myeloma Canada website, but it's also available if you want in a PDF form. If you give me your email address, I can send it to you. And it's got the links necessary to go deeper on a specific subject. I'll forget the disclaimer. We have a couple of good speakers here. I like this. This was, I thought, amusing. And this issue is complex, and from my perspective, I feel more hope when I understand something, and really that's where we're coming from. It's to give people the tools they need in order to understand the financial issues and the spectrum of them, either whether they're patients or whether they're caregivers. We have a couple of great speakers here to talk about the spectrum. Pina Tikagawa is our first speaker, and Pina's a senior financial advisor, and she's the manager of financial planning services at Kerr Financial, and she leads Kerr's executive financial counseling services and has 20 years of experience providing financial counseling to individuals as a fee-only planner. She's a certified financial planner as well as a registered trust and estate practitioner, and she's completed the Canadian Securities course. Pina's told me not to say that she's been working with me for 15 years to make me very rich. That was a Donald Trump joke, but anyway. And then secondly, we have Marianne Nemec who's speaking, and Marianne is a drug reimbursement specialist at a major Southern Ontario cancer hospital. And she's a regulated pharmacy technician with the Ontario College of Pharmacists. As such, she has extensive experience working with patients to obtain private and public insurance reimbursement and in providing information and assistance to patients on the front line at the hospital on drug-related costs. So she has 25 years experience in the healthcare industry, and she's worked in outpatient settings at several hospitals and pharmacies, including at Sick Kids Hospital. So the spectrum of financial issues that we're going to focus on today really consist of these 5 main boxes. The issues related to when one is employed, the insurance and employee benefits and how they apply, the pension issues and potentially how to access a pension if you want to access your pension early, which sometimes a cancer patient may want to. Some of the key issues related to employment termination, which are an issue if you go on long-term disability for a long period of time. Then the government programs that are available to people under 65 and over 65, from the standpoint really of drug coverage and then disability covers and so on. You'll see that in red, drug coverage is shown for both the employed, the under 65 and over 65, because really that's where Marianne is going to talk to us about. Pina is instead also going to talk to us about all the areas in black. She's also going to talk to us about some tax planning issues and estate planning issues, again, as an overview. And we're not lawyers or accountants or specialists in this field, so really we have to say that we've given this information as an overview and we've given the links, but for your specific circumstances, you should consult the professionals in this regard. Okay, so with that, I'll have Pina come up.
Mm-hmm.
Thanks.
You. Thank you, Jan. Thanks everyone for bringing me in and lending your ear for a bit. We've got, I'll try and talk to you. I've been allotted about half an hour, so I can get through a bunch of financial planning questions with you and topics. My name is Pina Tikagawa. I work with Curve Financial. We're a fee-only personal wealth management firm. We've got offices in Toronto and Montreal. Those are the types of individuals that I've worked with. But we've also given these seminars for individuals as they approach retirement. So this is a talk that we've done in the past, and we've given you our website link for your reference going forward. So what I do is financial planning, and when people think of financial planning, they think, okay, investments. There's actually a lot to consider. I'll be going through most of these items here with you today. So it's going to be a pretty packed presentation on that side. What we talk about with regards to financial planning is cash flow. So we take a look at an individual's income coming in, so what's coming in versus what's going out. Do you have any surplus? Do you have any ability to save, or is there a deficit? Are you actually spending more than you're bringing in? If that's the case, then it's something we would look at to look for opportunities for change. We also look at income taxes. Income taxes nobody likes to talk about. We will have just filed our tax returns in May, but the tax bracket, the highest marginal rate is 53%. The lowest is 20%. I know there's a big range, but it doesn't matter on which edge of the spectrum you are. There's still a fair chunk of your cash flow that would come out with relation to income tax. So you'd want to be familiar with how taxes factor into your situation. If you have kids, then there's opportunities for proper education planning, participating and assisting your kids should you establish RRSPs. Retirement planning is the one a lot of us hear about. So it used to be Freedom 55 that you would hear about. So really what you're doing, it's changed a bit these days. What you're doing is you're planning for a lifestyle that you would like to have in retirement. So it's a way to be organized and use your resources. If you have investments, financial planning also looks at that. You look down into your investments. Are they set up in a way that is effective for your situation, your risk tolerance? And the last piece that financial planning considers when we work with a client is estate planning. Do you have your wills? Do you have your powers of attorney? And are they set up tax effectively? So we do go through all of that with our clients, and I'll be going through most of that with you today. With regards to how we start, so what we do is we normally sit with a client and we go through a data gathering session. I'm not suggesting that that's something that we're going to do right now. What we're going to do is tell you how to do it for yourself. So what you would do is have a data gathering session with yourself. You would pull all of your documents out, and we've given you some assistance with what we suggest you start out with. So we suggest you list all of your assets and go through the exercise, because it would really help on the other end. You'll see as I refer back to it in my presentation, it will really make a difference to have all of this information at your fingertips. So list all of your assets by account owner. Is it in your name joint with your spouse, your name joint with your child? Go through that exercise. List the type of account. Is it registered or non-registered? And if it's registered, there's a beneficiary. Find out who that beneficiary is on the account. Many times there's no beneficiary, and there should be. So go through that exercise. List all of your debt. And what we want to do is we want to be, we want to really dig into all of our assets and our liabilities. Let's not run away from it, because financial planning is taking everything as it stands today and making it better. So you would list all of your debt, all of the interest rates, because there may be an opportunity for consolidation of debt. List all of your sources of income, because we want to become familiar with what we have access to and what's going to assist us. List your expenses. This one might be a bit difficult. So list your fixed and your non-fixed. So if you have property taxes, you can't change that expense. But if you spend money on clothes, your food, although we need to eat, you might be able to make some different choices. So let's get closer to that information. From this, we can actually do a fair bit. When I go through my topics, you'll see as I refer back how it can actually assist you with just having this at your fingertips. And then we suggest you locate all important documents: your wills, insurance, employee benefit booklet, and your pension statements. We've listed some examples of items that can affect your expenses as you take the journey. Individuals who have been on the other end of receiving cancer treatments have already been exposed to this, and if you're just starting out, what this does is hopefully make it easier for you to plan for something that is difficult to plan for. We've also done some research and shown that there is a financial impact of cancer. And again, what we're trying to do with this presentation is assist you with regards to planning, become informed, and make some positive decisions. So what do you have access to? If you are an active employee, well, your salary will continue. If you are no longer able to be an active employee, perhaps you switch on to short-term disability. Short-term disability is continuation of your salary, and generally, it's 100% of your salary, and it would continue on for 6 months. After short-term disability, you would go to long-term disability. And long-term disability could go on for 2 years or beyond, and it depends on where you fall with regards to that definition. The definition on whether or not you're eligible to continue on long-term disability is, are you able to continue on with the duties of your own occupation for 2 years? After 2 years, that definition changes, and it becomes, are you able to complete the duties of any occupation? So it's a very interesting change in definition, and at the 2-year mark, there is some concern as to whether or not your benefits would continue, and Jan will have some discussion on that on the next 2 slides. With regards to long-term disability, it can be taxable or non-taxable. So if you're on short-term disability and you know long-term disability is coming, then understanding how you paid for that premium while you are an active employee will assist you. So if you paid for that premium, when you receive the long-term disability, it will be non-taxable to you. If your employer paid for that premium when you're an active employee, when you receive it, it will be taxable. So that'll assist you with regards to managing your cash flow. And I'm going to pass that on to Jan now to fill in the pieces with regards to the employer.
Okay, thanks, Pina. Yeah, we just want to mention a few of the benefits that are available to employed individuals in the context of myeloma patients. And drug coverage is a big one. Marianne's going to get into it in some detail, but you may not know that 30% of the drug costs incurred in Canada are covered by private insurance as opposed to by various government plans. So it's a big component. And we know that Revlimid and other myeloma drugs are very expensive. So the issues pertaining to drug coverage are important, and you need to look at closely. Some drug plans have limits, annual limits, and that affects obviously some of the myeloma drugs, but there's also deductibles and co-payments that need to be dealt with. I've heard, though, that often even the manufacturer of the drug will kick in and sometimes pay for deductibles and co-payments. It's happened. Dental is of interest. We know about necrosis of the jaw for myeloma patients. We have to have very good oral hygiene. So having a dental plan is helpful, and obviously having ongoing dental care is important. Travel accident insurance, either through an employee benefit plan or on your own, if you go to Florida for the winter, is pretty important. However, most of those policies have pre-existing conditions clauses in them that state basically that in the event that there is a claim that is the result of myeloma or your pre-existing condition, that claim is excluded. So there are specialist brokers that deal with that issue and that deal with travel accident for individuals with pre-existing conditions, and instead of buying it by clicking on the website when you go through and buy your airplane ticket, it's really advisable to go to somebody that understands the issue so that you can get cover for your actual, your actual condition when you're traveling. Finally, a conversion plan. Basically, a conversion plan kicks in if you're coming off a group plan. So if you're terminated or if you've resigned your employment, then you're going to look at a conversion plan to determine really that you don't have to give information or medical records, and benefits continue on. And that's really the benefit of a conversion plan. Thanks. Secondly, in terms of employer and employee rights and employment frustration, it's difficult to terminate a cancer patient that's on long-term disability. There's a lot of wrongful termination jurisprudence in Ontario pertaining to this. Employers are very reluctant to do so. However, after a period of time on long-term disability, the employer is going to be getting antsy. The payments of the drug benefits are large, and long-term disability can be significant. And some employers engage lawyers to try to claim employment frustration. Employment frustration means basically that the employment contract is frustrated. The employee is never going to return to work. So the employer terminates the employee and usually negotiates some kind of package for severance and benefits. And is something that we need to look at when we're employed as long-term disability recipients and employees. Okay. So back to Pina then.
This is yawns, the end of yawns. He's got all the comics. So when we look at what opportunities do we have available, what we're trying to look at is how do we supplement the income that we have available to us. So we talked about employment. We've got short-term disability, long-term disability that we think about. We're also going to be looking at opportunities. What if you're not employed? What can we do? And what if you're over 65? What can we do? Before we get there, if you are employed and you have access to a pension plan, there are potentially two types of pensions. And maybe you have some opportunity to accessing those funds early, and how do we do that? So first, let's understand what the pension plan is. If you have a defined benefit pension plan, it's a promise by your employer to pay you a certain amount. So it's a guaranteed stream of income that you would be entitled to receive from your retirement for your lifetime. When you've passed away, then a percentage would continue to your spouse. If you have dependent children and your spouse passes away, it could continue to your children. If there's no dependent children, then a lump sum would be payable to your estate, depending on what guarantees you sign up for at the beginning of that stream of income, so when you first retire. If you take this pension early, you have the opportunity to do so. There would be a reduction. So if you look back to the pension booklet, as I said, that's one of the documents that you would pull out at the beginning. So if you look back to that document, it should list for you the penalty that you would face if you access this pension early. It's usually a certain percentage every year that you've taken it before your normal retirement age. It's important to note that that penalty is something, that reduction is something that occurs for the lifetime then that you are receiving this pension. So you take a penalty up front and then you receive that reduced amount for the remainder of your life. And it's an actuarial reduction usually, so it really accounts for the fact that you're accessing your pension early. But what if you want access to the money earlier? So you've got this guaranteed stream of income, and that's all nice, but you actually need resources immediately. You need to have access to resources available right away. What can you do? If you have terminated from the company and you are less than 55 years of age, you can opt for taking that defined benefit, that promise, take it as a commuted value. So it would be a present value calculation. They would present value that stream of income. They would give you this bag of cash, and you would take this bag of cash, go to the bank, and deposit it into a lira. And you've now terminated your relationship with your employer. You've now got this money going into the bank. It's sitting there as a lira, and there's opportunities to access that, and I will get to that in 2 slides. But there is some opportunity to access this defined benefit earlier. With regards to a defined contribution, so I said at the beginning 2 types of pension. There's defined benefit, which is the guaranteed stream of income, and defined contribution. Defined contribution is an account that receives contributions from yourself and your employer, and it builds to a certain level. At retirement, that amount will then support the income that you receive through retirement. Again, as you approach retirement, funds from this transfer into a lira. So now we've talked about lira 2 times. The only way you can get money into a locked-in retirement account is from an employer pension plan. Once you have this lira, the only way you can access it is if you're 55 years of age or older, unless you are able to unlock it. And I'll talk about that in a second. So if you've got this lira, at 55 years of age, you go to the bank and you say, can I have my bag of money? Thank you very much. And you give it back to them and you say, now here you go, here's the bag. Please re-register it as a locked-in fund. You get a guaranteed stream of income or a minimum amount that needs to come out every year. And then there's a maximum. And it's this maximum that we're trying to get around. Locked-in funds or locked-in retirement account, you do have access to it, but there are maximums, and we're trying to look for opportunities around that. So how can you unlock money? If you've got financial hardship, and we've listed some financial hardship components there. If you've got a shortened life expectancy, If you've got reduced value, so if the value is actually low, that's in the lira, and then there's this age 55 provision. So if you are 55 or older, you've got money in this lira, you convert it to a LIF, and then you say, you know what, I want to unlock 50%. You take 50% of the money in here, and it goes to an RRSP. Still in a tax-deferred environment, so no tax implications, but money out of an RRSP has no maximums. You now have full access to this. When it comes out, it's taxable, but there's no restriction on accessing it. So there are some complications. You do have to make that election quite quickly once you've converted from a lira to a LIF. And you should work with your investment advisors with regards to completing that application, but there is some value to looking at that. So moving on from that, now we've looked at short-term disability, long-term disability. We understand cash flow from an employer. If you have a pension plan, opportunities. What if we don't have any of that? Now what do we have access to? How does the government? Can the government assist us in any way? And they do offer programs. So there's employment insurance, Canada Pension, disability benefit. There's Ontario Disability, and these are Ontario Disability, ODSP, and Ontario Works are income tested. So if you have $1,000 of income per month and $5,000 of assets, then you'd be entitled to access those programs, otherwise you wouldn't. And then there's the allowance or allowance for survivor. That's for a spouse of an individual who's on old age security and has no other source of income. So if you wanted to access employment insurance, we've given you a website link. And again, if you want to get a copy of the slides and you give Jan your email address, he'll send those out to you. It'll be easier to access that website link. With regards to employment insurance, if you're unable to work due to sickness, you can get up to $524 a week. That was the 2015 measure. CPP disability, this is a bit of a threshold, so you do have to have a prolonged disability. We know some individuals with myeloma who have applied and received it, some individuals who have applied and have not. Worth the application. CPP would be based on the number of years you were working and contributed into the plan. There's a top-up for the fact that you're disabled. So the disability amount is $453 if you qualify. And there's some value to just trying to access this benefit. Now you could be on CPP disability for a fair bit of time, and then once you reach age 65, it converts down to CPP retirement. And there more likely would be an adjustment downward, so I want you to be prepared for that, because that top-up relating to the disability amount drops off. But worthwhile in pursuing. And then the ODSP, Ontario Works, are both income tested, and we've given you some links to access that. So we know government supports us if we're under 65. We have to make the application. Do we qualify? We've given you some links. Now what happens if we're over 65? Well, if you're over 65, you can access CPP retirement benefit. It's based on the number of years you worked, the amount you contributed into the plan. It's a taxable benefit to you. You can actually access it before 65. You can access it starting at your age 60. It would be a 6% reduction for every year you are under the age of 65. So if you access it at 60, it would be a 36% reduction, and it would be a permanent reduction for your lifetime. So the reason that, again, it's actuarially calculated, you're accessing this benefit 5 years earlier, so they can't give you the same amount, they have to reduce it. So there's some value to looking at whether or not that works for you. You'd then be entitled to also old age security. That is based on the number of years that you were in Canada over the age of 18. You don't have to have worked to qualify for old age security, but you do have to have lived in Canada for a number of years. There is a clawback, so if your income is from about $80,000 to about $120,000, then you have to pay a percentage of the old age security back. If it's over 120, you're not eligible for old age security. If it's actually on the other end of the spectrum and all you're receiving is old age security, then you can also receive this guaranteed income supplement, and if you have a spouse, they can receive an allowance. So you have to apply for these. They don't automatically get passed to you. Send in the application, and every year when you file your tax return, that will be determined what you're eligible for old age security. There are also some programs for caregivers that we've provided for you there, some links. With regards to accessing this, you have to have a minimum life expectancy, but if you have caregivers that are providing you assistance, this does protect their job for them as they're off providing you with care. So what are we looking at? We looked at now government benefits. We understand that. We understand employment benefits. Let's keep going. What else do we have access to? None of that applied to me. Where else can I access resources? I need assistance with regards to resources. What else can you look to? There's TFSAs, RRSPs, RIFs. In this market where every 2 seconds you hear about how great this real estate market is, are we lucky enough to own our own home? Is it mortgage free? Is there some equity in there? If there is, we can look to that potentially. What do we need to consider? Our favorite item, everyone loves to talk about taxes. So you always need to understand the tax implication of accessing these resources, and I'll talk about that, and the impact on your future. If you've always thought, we have a lot of clients that come in and say, you know what, I'm going to spend everything I have, but I want to leave my house to my kids. So if that sort of sounds like you, and you actually need the resources and you're going to tap into this, then know that that has some implication for the future with regards to your children. So quickly, let's go through the RRSP and what that means. An RRSP is a registered environment. It's just an account that's registered. You put money into that, and you get a deduction. Income grows tax-free, money comes out, and you're taxable. Once you turn 71, it needs to convert to a RIF. A RIF, once that's established, a minimum amount needs to come out to you every single year, and anything that comes out of an RRSP or a RIF, this tax-deferred environment, is taxable. So we need to understand the tax implications on that. If you take out, say, for example, $5,000 from your RRSP, there's 10% withheld at source by the institution. But when you file your tax return, you may still need to pay additional tax depending on your marginal tax rate, and we'll talk about that. So I've given you some information on the amount that needs to come out every year depending on your age. And this new product, TFSAs, Tax-Free Savings Account. It's a little different with RRSPs. If you put money in, there's no refund that you're getting from your tax return. There's no deduction. Money grows tax-free. When it comes out, there's no tax. So now if we think, hang on, I need some additional resources. I've got an RRSP and I've got a TFSA. Where are you going to draw that money from? What are you going to access? Will you look to your RRSP or your TFSA? You want to ensure that it's something that doesn't have a tax implication. And then we look at your house. So what can your house do for you? Well, there might be some equity in your home. Could you establish a reverse mortgage? Now, a reverse mortgage is just that. You have to keep in mind they can quickly build. So it does give you access to equity in your home, but very quickly, $100,000 can turn to $110,000, $120,000, $130,000 mortgage on your home. So a reverse mortgage does have a time and place. We have had some clients use it successfully for very limited time to support a quality of life that they were not able to do on their own. So there is some value to it. You do want to keep an eye on it and don't let it get away from itself. The alternative is you could look to a secured line of credit, secured against your home, and then it doesn't get out of control for you. Again, those are Jan's. That's Jan's contribution. So tax. Now our favorite topic. So tax season will have come and gone. You will have filed your tax return. That happened May 2nd. In Canada, we file one tax return federally and provincially, except if you live in Quebec, then you actually file two tax returns, one federal, one provincial. For tax planning purposes, you think of the two rates together. I've given you your federal and your provincial rates. They are tax rates, tax brackets. And if you think about climbing a flight of stairs, so you're the lower level of the staircase, and that's your level of income. As you climb up this flight of stairs, you climb into a higher tax bracket and a higher tax bracket. So if, for example, you have $50,000 of income, the marginal tax rate, if we look at 20, you didn't think you'd be doing math today, right? So if we look at 20 and 9, 20 federally, 9 provincially over there, then your marginal tax rate is 30% on the next dollar of income. And that's important because you have $50,000 of income, and you need $5,000 from your RSP, and the institution withholds 10%. When you file your tax return, are you going to pay additional tax? Yeah, you need to have that money set aside because your marginal tax rate is 30%. The institution only withholds 10%. So understanding that there's a difference between marginal rate and other tax implications on resources that you access. Now, as cancer patients, you might also be eligible for some credits. Credits are not as attractive as deductions. They come to you at the lowest marginal rate, which is 15 plus 5, so 20%. That doesn't sound so attractive, but in fact, there is some benefit when you look at the numbers. So there's a disability tax credit that you might be eligible to receive. And you see for 2015, it was $78.99. 20% of that would mean a $1,600 reduction to your tax. And there's some value. Now, it does have a high threshold, so you need to have prolonged impairment in physical mental function. However, we know some individuals with myeloma who've applied and have been turned down. Some individuals have applied and have been approved. So, worthwhile, you just complete the application, submit it into Revenue Canada. Your doctor has to complete that as well. There's an area for your doctor to complete. You sign and submit. And if they accept you, then you're now eligible for some other planning opportunities. And if they don't accept you, then you can try again. But it doesn't hurt anything to apply. You also have some medical expenses, and they're given to you as a credit. So keep track of all your medical expenses, not credit card receipts, the actual receipt. And as a caregiver, there are some credits available to them as well. It's called a caregiver credit, so they can access that and look at that to see what they can benefit from. If you've been approved for the disability tax credit, you're eligible to open up an RDSP. That sounds exciting, right? So you're like, yes! This RDSP is a new product. It actually was very exciting when it came into being because it gave us an opportunity to plan for retirement for individuals who have disabilities and have difficulty doing so. So if you've got yourself or if you've got children and it's difficult to set money aside, then this actually was really exciting when it came through because it gave us that opportunity. When you put money into this plan, there's no deduction. Money grows tax-free, and you could possibly get a grant of $3 for every dollar that you contribute. So imagine 300%, depending on your income. So that's pretty exciting. And when money comes out, the income in the grant is taxable, but not the original contribution. So definitely worthwhile pursuing and determining whether or not that's applicable to you. So we're on to the last piece, 5 minutes. On to the last piece, which is estate planning and looking at what that means for you and how we address that. So you may have heard Prince has just recently passed away, and we were all sad about that, and I don't know if you heard what followed. He has no will. He had no will. So a lot of stepbrothers and stepsisters coming out of everywhere, because if you don't have a will, you go to the courts and it gets distributed, it gets descended upon in line with your family members. So it goes to a spouse a certain amount, and then it travels down and it goes to your brothers and sisters. So they were coming out of everywhere, and imagine his actual sister, that would have been tough for her to go through. So for your survivors, it becomes really quite difficult if you don't have a will and you don't plan. So the first thing I'll talk about is actually a power of attorney. And a power of attorney matters while you're living. So while you're living, you assign this power to someone who can step into your shoes and make decisions on your behalf. They can sell your house, they pay your mortgage, your property tax, your bills, make investments, but they have a lot of power. And it's in a moment when you actually are not able to do anything for yourself. So it's really important to have these available for yourself. But it needs to be with someone that you can trust, and they are live from the moment you sign. So you give it to someone who actually can step in, and someone that you trust, but also on the other side, you can also leave it with your lawyer and give your lawyer instructions on when that's to be released. So power of attorney for property and for personal care, someone to make decisions with regards to your personal care. They don't have to be the same person. They can be different people. There can be more than one person. So there is flexibility there. Power of attorney only matters while you're living. When you're not living, they don't matter anymore. You don't look to a power of attorney, you actually look to the will. So it doesn't matter who you've assigned the power there. Once you've passed away, it's your will that's the governing document. We've listed some decisions here for you. If you do not have a will, you should have a will. Everyone should have a will. If you don't have a will, you should have one. We've listed some decisions, so when you go to your lawyer, if you have these decisions, it will make that easier. What decisions should you come up with? Who's the executor? So that's the person who's going to take charge and distribute everything, file your tax returns. So it's a big job. Usually if you have a spouse, it's your spouse. We suggest having an alternate executor as well. If you have minor children, come up with who the guardian would be. If you have bequests, lump sums that you want to pay out immediately upon your passing, list those. And then you have distribution. So how does everything else get distributed? Primary is if you pass away alone. Secondary, it's you and your spouse pass away. Third level, we call disaster clause. If all the family passes away, how should your assets be distributed? Very difficult decisions. If you do that before you're sitting in front of a lawyer, it'll save you time. What does that mean? It means hourly rate. It'll save you fees. Another decision that you have to come up with is a trust. Do you want to have a trust in your will? And what is a trust? Well, a trust is a separate taxpayer. It's a separate entity. And it taxes, and income in a trust is taxed at graduated rates. So you've got a nice income splitting opportunity, and that itself sounds exciting, but that's only for 3 years. A trust really comes into effect if you want to protect the ultimate beneficiaries, the individuals who are ultimately receiving your money. So if you're an individual and once you pass away, you've got $100,000, let's say, in your estate, it goes to your spouse in trust. And then your spouse passes away, it doesn't distribute to her new secondary spouse. It actually looks back to your will and says, well, now what do you say? Where is it supposed to go? And you say, oh, my children. So it goes over to your children. So there is some value in having a trust with regards to protection. It will protect the ultimate beneficiaries for you. So if you have a second marriage with your spouse, it protects against that distribution. If you have an adult child and they're not good at managing their money, and if you give them an inheritance all at once, they spend it, it would be good for them. And if you have been approved for the disability tax credit, you are also approved for graduated rates on income in this trust for your lifetime, which means there is a tax splitting, tax savings opportunity for you. And what does that really mean? It only has any value if you're expecting an inheritance. So if your parents are doing their estate planning, and hopefully everyone's comfortable talking about the estate planning with them, you say, you know what, I've actually just been approved for this. Can you put a trust in your will? I, as the beneficiary now, will receive a preferential tax treatment on any income coming out of there. At the tail end here. So your wills and powers of attorney, you go to an estate lawyer and make the personal decisions as I've outlined for you. And we've got some charts to help you get organized. If you have life insurance, keep that going. Once you've let that lapsed, it's really hard and might be really quite onerous to get new coverage. So you want to consider your survivors, what do they need? Your minor beneficiaries, what do they need? You could look to saving probate. If you go see a lawyer, everyone's all about saving probate. I don't want to have to pay probate. It's going to cost me money. And what is probate before we think it's such a dirty word? It's 0.5% on the first $50,000 of money going through your estate, 1.5% on anything above in Ontario. On $500,000, it's $7,000. But if it ultimately protects your future, your children, the ultimate distribution you would like, the only way to get that money into a trust is to have it go through your estate and for you to pay probate on it. What goes through your estate is anything that's in your name alone, or if it's payable to the estate. So anything without ownership, now we come back to ownership. Anything without ownership gets payable to your estate, exposed to probate, that can be used to fund up a trust. So pretty complicated. That's why when you get your wills and powers of attorney done, go to do it with an estate lawyer, not someone who did your real estate closing, but someone who's really familiar with the ins and the outs. And quickly, I'm stealing time now. How do your assets pass at death? Well, if you want it to go outside of your will, your registered assets, list a beneficiary on there. Usually, if it's your spouse, if you have a spouse, it's your spouse, because there is tax deferral there. If you have life insurance, think about who you would like to have as your beneficiary. If it goes directly to them, there's no tax, but you can't fund up a trust with your life insurance if you do that. And anything in joint name passes outside of your will, but don't rush to put things into joint name, because if something were to happen to you, it does automatically go to them. And is that what you want, or do you want it to go equally with your kids? They have access to it from the moment you put it into joint name. They can take out a loan against it. So there's a lot of implications with rushing to this joint ownership, and we've got considerations with regards to beneficiaries there. We've got some charts for you with getting organized, and over to Marianne.
Okay, so back to our first slide. So Pina has gone over 90% of this, so I'm going to cover the drug coverage. You're definitely a hard act to follow there, my dear. So anyways, my name is Marianne. I do recognize only one person in the audience, and that is Ralph. I believe we have spoken. So I'm a medication reimbursement specialist, or a drug navigator, at one of the cancer centers in downtown Toronto. So I'm going to briefly talk to you about drug coverage and any patient assistance programs that are available and how to access them through your healthcare facility. As many of you are aware in this audience, there's an increase in patients being diagnosed with cancer each year, which means there's an increase in treatment costs and costs in and outside of hospital. Fortunately, there are many drugs accessible for treatment, and there's always new studies and therapies on the market and to maintain better cure of a disease. Even though these drugs are accessible on the market, it does not mean that the average person can afford treatment, which is where I would come in and try to help procure a drug for you. The list before you is just an example of what a myeloma patient would probably see in their lifetime. I'm not sure if everybody here is on medication yet, so these numbers can sort of be alarming when you see them in terms of monthly expense and yearly expense. Unfortunately, most likely it'll be a combination of these meds, not just one med that you'll be on. And then it's important to remember if there's another disease happening as well, if you have diabetes, cholesterol, blood pressure, depression, the ticket value for medication does go up. In terms of the circle of care, I apologize. After seeing this slide, we really should have put a family component in here. It focuses on the healthcare team here, but family should be included in there. So as a patient in any setting, it's important to know that I'm just one of many people that are involved in securing medication. So in terms of the circle of care, sorry, just going back, I'm just one of many professionals that are involved in securing medication for you. It's a collaborative team that provides diagnosis, treatment, and access to therapy. Your healthcare professionals are working together to minimize your physical, emotional, and financial burden once the diagnosis is given. It's also important that as a patient you have family support from members of your family or friends to help you understand and comprehend what is happening at every appointment. Just on a personal note, that last portion is very important. If you're a cancer patient and you really don't understand what's going on, please have a family member go with you or a friend. I'm just saying that because my dad was diagnosed with cancer and I know he had white coat syndrome, so as soon as he saw a doctor, he tuned out. He became a 4-year-old child and didn't register anything. So it's very important that you have someone there who understands what's going on. Okay, so as a reimbursement specialist, it is my role to completely do an investigation on your insurance and to evaluate whether you need supplemental coverage in terms of Trillium. In this investigation, I would call to see that your treatments are covered, whether you need special approval or whether there are limitations in your plan. And it's very, very important to know what your limitations on your plan are. It could be anywhere from dollar value per year, dollar value per lifetime. There could be a limitation on actually where you are allowed to fill your prescription, and there could be limitations on the amount of drug you're allowed to access. I would complete all this paperwork for you, and I would look into patient assistance programs for those who do not have 100% coverage. So for instance, if you're prescribed drug A, you have 80% coverage. If there's a program that would allow for the extra 20% to be paid, I will look into that program and sign you up for it. Okay? There's always going to be a financial element to those programs, so you'll probably get a phone call from those programs that you're enrolled in to make sure that you qualify for that assistance. So the goal here really is what I need you to know when you leave this room is that there is always an advocate in the hospital, whether it's a doctor, a nurse, a social worker, or myself. We are really trying to get that medication to you as quick as possible with the least amount of financial burden. So the goal is obviously to get 100% coverage. If for some reason we cannot access through your private plan, it's possible to escalate to the manufacturer to get free drug. The only way to get free drug is for me to actually go through the entire process of private insurance and Trillium to make sure those entities don't pay. What coverage is available to us? Well, the two main ones are private coverage and provincial. Sorry. So it can be employee-sponsored or self-purchased. So someone who has employer-sponsored insurance is someone who's working full-time and has coverage through their employer. Self-purchase is someone who probably is working, has their own business at home and has decided to purchase insurance on their own. It's still very important to know your limitations on these plans as well. yearly maxes, lifetime maxes, and also there are some plans that are still operating in the old system where you have to pay and submit. So those who are on myeloma meds now, most people can't afford to fork up $10,000 a month ahead and then get reimbursed. So it's very important to know those limitations. In terms of having restrictions on your plan, sorry. Thanks. If you have restrictions or limitations on your plan, you may need to coordinate with your spouse's insurance. So there's possible dual coordination of benefits. So if you have benefits for yourself and benefits through your spouse, there's coordination of benefits that happen at the pharmacy. You can have more than one plan for yourself, you can have more than one plan for your spouse, and you can also have government funding. So there's a possibility of 4 to 5 plans for a patient to access. In terms of private or provincial, public, it's the ODB drug benefit formulary. This slide just shows that it's under the same umbrella, meaning anybody who's a senior under ODSP Ontario Works, home care, long-term care, or Trillium, we're billing the same entity. We're billing your health card number when you go to the pharmacy for your drugs. The only difference here is the amount that the patient will pay out of pocket. So for instance, if you're a senior, once you're 65, you're covered by the government the next month after your birthday. So if your birthday is May 15th, you're covered as of June 1st, okay? In terms of Trillium, Trillium is the only one that has a deductible associated with it. So there's a 4% deductible that the patient is responsible for, and that's based on household income. It's not patient income, it's household income. It's very important to know that. So if you have 4 people in a family, 3 are working, we need income from all 3 people. Okay, so it's not just income from the one who is sick. It's very easy to access Trillium. Everybody's approved for Trillium. Not everybody's approved for the middle 3. Okay, I have access to only Trillium for you, but every application is approved, regardless if you make $10,000 a year or you make $1 million a year. Your deductible is just based on income. In terms of Ontario drug benefit, it's not the same as OHIP. People think that when they show their drug card in a pharmacy, that they're automatically registered for drug coverage. No, you actually have to sign up for a program like Trillium. It's important to remember with Trillium and any of the tiers that were under that umbrella, that not everything is covered. There is a formulary that's online that you can actually access yourself in terms of coverage, so you can actually check for yourself to know if a drug is covered. I would say that 99% of cancer drugs, for those who are on Trillium already or will be on Trillium, will have to get approval for their drug. Okay, it's not something that will be covered right away, so that's where a physician or myself would have to do extra paperwork in order to get coverage for you. In terms of getting approved, there is criteria to get the drug. So for instance, to be on Revlimid, you have to be a myeloma patient. If you're being prescribed Revlimid for another reason, chances are you're going to be denied. It has to fit the criteria that the government sets out for you. In terms of the approval process, here it says it takes about 2 to 3 weeks, depending if paperwork is done correctly and the government doesn't ask for more information. It could take up to 2 months. But please remember, we're doing everything we can to get that drug to you as fast as possible. Okay? For the Trillium Drug Program, you must be a resident of Ontario, so it's important to know that if you're coming from Quebec and you're getting treatment here, you can't apply for Trillium. You have to have a valid health card. And just as an example for this case here, we had a patient who didn't renew their health card. You can't go to a pharmacy and expect a pharmacy to bill the government for your medication if you haven't renewed your health card. It's very, very important to keep your health card up to date. Let's just move forward here. This is a typical example of what a family Trillium deductible would look like. So for someone who is in the 50,000 income bracket there, so let's just say your net income for your family is 50,000. There's a family of 3. Trillium would expect about a $1,700 deductible per year to be paid out of pocket by the family members. Not just the patient, all the family members. And that's tracked anywhere in Ontario at any pharmacy. Okay? You will never get a bill by Trillium, so that's $1,700. They don't send you a bill for $1,700. They collect that money as the family fills prescriptions. I know this is kind of where people get lost with Trillium, so I'm going to try to do just a very simple case. So for someone who has a deductible of $1,000 per year, whether that's an individual or a family, Trillium's year starts August 1st to July 31st, not calendar year January to December. So for someone who has a $1,000 deductible, whatever the deductible amount is, it's split into 4 equal payments during the year. So August 1st, November 1st, February 1st, and May 1st, those dates are in stone. This person would be expected to pay $250 towards their deductible on those dates, provided they're filling prescriptions on those dates. So let's do a case example. Today's August 1st, you come in with your myeloma prescription, it's $10,000. Take the prescription to pharmacy, pharmacy bills Trillium. Trillium's gonna pay everything out of that $10,000 except that $250, which the patient has to pay. You've satisfied your deductible for that quarter, so everything from August 1st to November 1st technically is 100% covered as long as it's on the ODB formulary. The same thing will happen come November 1st. November 1st, if you come in, you fill your Revlimid, the same process starts again. If by some chance you feel nothing from August 1st to November 1st, that $250 in that first quarter gets shifted to the second quarter. Now you owe $500. The government wants their money regardless whether you fill anything August, November, or February. So for instance, if you fill nothing for the first 9 months, May 1st, you're gonna owe the whole $1,000. Okay? You can ask more questions after the question period if that doesn't kind of make sense. I kind of lose people after explaining this. In terms of resources, in terms of cancer patients, Jan wanted me to mention these 2 places, Wellspring, and then there's another support group at Toronto General. I did look at Wellspring myself in terms of patient care, and I find that they're quite superior in what they do offer patients. I'm not sure if anybody in the audience has accessed them yet, but Wellspring has a couple of agencies in Ontario where this one, the bottom one, is only at Toronto General. So Wellspring offers a variety of programs, especially the money management program there. You need an appointment for that though, in terms of if you have financial issues. But they have everything from the money management to exercise to yoga to support groups, family support groups. What I did like is they had an art component, art therapy. So people who wanted to kind of forget about their disease state, there is painting, there is creative writing, there is drumming. So it does offer a wide range of programs for you. I'm not sure if you're going to close.
No, that's good.
That's good. Okay, so I think we're wrapping up. So hopefully we didn't lose you kind of over the last hour. So I think we're about to take a break, and then we're going to have some questions. The patient is asking if a drug only becomes available in one strength and they're being prescribed half that strength and the patient has to cut the pills themselves. What is the patient to do in terms of cutting those pills properly, because they usually shatter when they're small pills and you have to cut them in half. So he's questioning why there's a dispensing fee, and isn't it the pharmacy's sort of position to help the patient out in terms of cutting. I will personally say the pharmacy that I work with on the weekends, I would cut the pills for you. So any good pharmacy, any good technician would offer that service for you. So pill cutters are great, but there are pills that are film coated that shatter. There are pills that are too small to cut. So I would go to the pharmacist or the owner and ask them to cut the pills. It's a simple solution.
Do they have a particular machine that will do?
No, we use the same thing you do, but we're probably more well-versed in cutting the pill. If it's scored, it's easier to cut on the line opposed to cutting it off the line. But good customer service would, they would offer to do that for you. So the question was that there is a website that people can access called drugcoverage.ca in terms of what avenues to go to get something covered. That is available. I do not use it because I sort of know that stuff off by heart, but there is always someone there to help you. In terms of any cancer patient, I find it hard to believe that there is not a doctor, a nurse, a social worker that you could go to. Even if you're not aware of that website, someone is there to help you. So you should never feel alone in the process. Always ask the questions. One thing I just want to reiterate, I had a patient who didn't want to ask the doctor a question. She felt that she was putting the doctor off. The doctor was getting nervous because she was asking too many questions. That's what the physician or nurse or social worker, or that's what I'm there for. I mean, there's always access to information. If you don't ask, it won't be available to you.
Yeah, so the question was, you could take the commuted value of your pension, you can deposit it into a lira. How do annuities factor into this? So you can convert that lira into a LIF, or you can convert it into an annuity, and that would take, so you would take, in a sense, that bag of cash, you go to an insurance company, give them that bag of cash, and say, I would like now a guaranteed stream of income. So it's almost as if you're giving yourself a pension. So if you think about it, you're now locking in a guaranteed stream of income for yourself, which is what you just walked away from. So if you take a commuted value from a defined benefit, the reason you're doing that is because you want to walk away from this guaranteed stream of income, because annuity is very similar to that. So if you pass away, do you have a joint annuity? Would it continue to your spouse? Is it a single life annuity? Does it pass away? Does it end when you pass away? And if that's the case and you've got a spouse, then your spouse loses out. So there's, it does function like a pension, probably not as well as a pension from your employer. So if you're taking the commuted value, it's not that you're looking to purchase an annuity, it's more that you're looking to have access to that lump sum of cash.
I'll just address one question that came to me on our break. Anybody getting prescriptions for myeloma, there is a restriction in terms of 4 cancer centers or 4 pharmacies that can dispense in Ontario. So you are restricted to the 4 that can dispense. You are not restricted to which one can dispense for you. Okay, so that did come up in question in terms of, do I have to get my prescription filled here? Do I have to get it filled there? There's 4 centers that can fill it. Any 4 centers can fill that prescription. If by some reason you wanted to transfer the prescription, you really do need to get in touch with the pharmacy that you do want to have that dispensed and have that transition go smoothly. But so you're restricted to the 4 in Ontario, but you're not restricted to which one out of the 4 dispenses. Okay? Okay, so the question was the Exceptional Access Program, which used to be called Section 8. It's called Section 16 now. So the Exceptional Access Program is for drugs that technically are not covered under the Ontario Drug Benefit umbrella that I showed you, under the seniors plan, under Trillium, under anybody that's on social services, on anybody that's on home care or long-term care. So most chemo agents, oral chemo agents, fall under the Exceptional Access Program. So there's a list of drugs that is technically not accessible until we apply to have them approved. Revlimid is one of them. Pomalyst is another. I haven't dealt with thalidomide yet. So for instance, if you are 65 already, you get prescribed Revlimid, you go to the pharmacy, it will not go through. It's not a regular benefit online. So the doctor has to apply to get that covered for you, or I would apply on your behalf. It's a simple form that we have to fill out, but you have to meet the criteria to get it covered. So for instance, if you're a Revlimid patient or a myeloma patient for Revlimid maintenance or relapse therapy, you're covered. If you're getting Revlimid for any other indication other than that, chances are it will be denied. It has to be according to what the government has set the approval process for. Okay, so there's always criteria for each drug. And just remember, the approval does not happen overnight. Okay, so usually I get a heads up that something is coming down the line. We apply right away, so hopefully by the time you come back for your next appointment, that approval is in place.
So the question is, at what point do you have to convert that RRSP to a RIF? And it's by December 31st in the year that you turn 71. You need to convert that RRSP to a RIF, or the RRSP will fully come into income and you will be taxed on the full amount. Well, you can still do that right now. The question is, do I have to convert the whole RRSP, or can I split it out? You can actually do that right now. You can take, right, you can take money out of, you can take the asset out of the RRSP. Yeah, so then the question is, can I take it out? And what's the implication if I take out this worthless stock now from my RRSP? So you're taxed on the amount that's coming out of the RRSP. If there's zero value, there's zero tax. So that's why it starts to get interesting when you start thinking about financial planning in your situation. You always think about, oh, hang on a second, what if I do it this way? And that's why it's nice to sort of set some time aside, pull out all your information, and really devote that headspace. And you can usually come up, once you start doing financial planning, you'll surprise yourself. You can usually come up with a couple of ways to save money, reduce taxes. You'll come up with something to make your situation better if you just spend a little bit of time, access a credit, maybe you apply for a credit, you look at your tax returns and you think, oh darn, I didn't do that on my tax return, maybe I should do that. So there's usually something you can come away with. So the question is, do the cancer centers have a financial person that can provide assistance? And I don't have any really thing to...
Yeah, I think that the actual cancer hospitals themselves tend not to, but there are organizations such as Wellspring and the various Wellspring type entities that do offer specific financial consulting as well as seminars, and that's as well as Elixir, which we mentioned as well. Those are probably the sources that are free for cancer patients for that financial resource as opposed to the hospital itself.
The 4 cancer centers in Ontario, so I'm having a problem remembering the 4th one. So there's Princess Margaret, there's McKesson Pharmacy, which I'm sure a lot of you are familiar with. There's London, and I'm sorry, I can't remember the 4th. So if I remember after, I will look it up for you. What portion of patients are on Trillium? I can't give you an exact number. I would say at least 50%. Just because there's a lot of people who have limitations on their plan. So if you have private and it covers 100%, we're good to go. But anything can happen. You can get terminated, the company closes, whatever. Trillium is always good as a backup anyways. But I would say at least 50%. The application itself is not difficult. It is pretty much your name, address, phone number, health card number, and your social insurance number. That is all the application is. As long as everybody on the household is on the application, you're good to go. In terms of income statements, all you need is your notice of assessment from the prior year. So I think it's just a matter of talking to someone who knows how to simplify the process for you. If you call me, I would certainly do the application for you. I will fill it out for you, so pretty much all you would have to do is sign the application. I do give you copies of what I need in terms of income statements. It's pretty seamless when there's someone else involved. If you're doing it yourself, it does take quite a bit of time in terms of getting an answer back from Trillium. If you do mail it in yourself, I can sort of expedite that process if it comes through a medication reimbursement specialist. The application, like I said, is not difficult. It's understanding Trillium once you get approved, and that's where the problem lies, where you're approved, but you don't know what you're approved for, what you're paying for, when you have to pay for it. Do you send the receipts in? Why am I paying for stuff? So it's always good to have someone like myself or even a pharmacy technician at your local pharmacy help explain that. But that's why my role has been created in terms of streamlining that process and having less difficulty in you understanding what the procedure is. I hope that answers your question.
Thank you very much. Your pleasure.
Thank you, everybody.